Many expecting mothers quietly wonder about marital intimacy during pregnancy, especially as birth approaches. Some hear advice from elders, some read medical opinions online, and many feel unsure what to believe. This video is created to explain this topic calmly, respectfully, and safely without pressure, without judgment, and always with your well-being at the center. Let's begin with an important truth. In general, for most healthy pregnancies, marital intimacy is considered safe. It does not harm the baby, because the baby is protected by the uterus, amniotic fluid, and muscles. However, safety depends on your individual health, pregnancy stage, and any doctor-advised restrictions. Marital intimacy during pregnancy is not required, it is not a guarantee, and it is not right for every woman. But for some mothers, when it is safe and approved by a doctor, it may gently support the body's natural readiness for birth. Elders often believed that gentle closeness between partners near the end of pregnancy helped the mother relax and feel emotionally supported. They observed that when a woman feels calm, safe, and loved, her body responds more softly. Their wisdom was never about forcing labor, it was about allowing the body to prepare naturally. Medical science helps us understand why this belief exists. Doctors explain that intimacy may release natural hormones such as oxytocin, which supports relaxation and bonding, and prostaglandins, which help soften the cervix over time. These hormones do not start labor on their own, but they may support the body only if it is already close to readiness. This is why doctors emphasize an important difference. Supporting readiness is not the same as starting labor. Intimacy cannot force the body into labor if it is not prepared, and it does not work the same way for all women. Now, let's talk clearly about timing, because timing matters. Medical professionals generally say this is not recommended before 37 weeks of pregnancy. Before 37 weeks, the baby is still completing vital development, especially of the lungs and brain. Stimulating hormones too early may increase the risk of early contractions, which is why doctors advise caution. After 37 weeks, when the pregnancy is considered full-term, some doctors may say it is safe only if the mother has no medical restrictions. Even then, it must be gentle, comfortable, and fully approved by a healthcare provider. It should be avoided completely if there is bleeding, placenta conditions, leaking amniotic fluid, a history of early labor, infections, or if the doctor has advised rest. Safety always comes first. Now, let's talk honestly about advantages and disadvantages. Possible advantages, when approved and comfortable, may include relaxation, emotional connection, stress reduction, and gentle hormonal support. Feeling calm and emotionally supported can help the body work more smoothly not just in pregnancy, but in labor as well. However, there are also disadvantages. It may cause discomfort, pressure, fatigue, or emotional unease. For some women, it may increase contractions that feel worrying. For others, it simply feels unpleasant, and that matters. And here is something very important to understand. This does not happen for all women. Some mothers experience no effect at all. Some feel relaxed. Some feel discomfort. Every body responds differently. Now, let's address a very common question. Why do many pregnant mothers not feel interested in intimacy? Science gives us clear answers. Hormonal changes, nausea, fatigue, body discomfort, back pain, emotional stress, and self-image changes all play a role. In later pregnancy, pressure on the pelvis and sensitivity can make intimacy uncomfortable. Emotionally, many women are focused inward on the baby, on preparation, on rest. This is normal. Loss of interest does not mean something is wrong. It does not harm your relationship, and it does not harm your birth outcome. Doctors agree on this point very clearly. Intimacy is generally safe for most healthy pregnancies, but it is never required for labor to begin. Many women have healthy, natural vaginal births without it. The most important factors for birth preparation are medical safety, emotional calm, trust in the body, and supportive care. If intimacy feels right, safe, and approved, it may gently support the body. If it does not feel right, declining is the healthiest choice. There is no pressure. There is no rule. There is only what is safe, comfortable and right for you. Remember this: birth is not something you force. It is something your body moves toward in its own time. A supported mother brings strength into birth, and your comfort, safety, and peace always come first.